Today I have with me Dr. Tracey. You probably met Dr. Tracey in our clinic already, and you used to see us both in scrub and uniform, so we are glam up today and we're going to share with you some of our experience and some problems that we experienced during pregnancy, because we both moms and Dr. Tracey has two lovely children. I'm a lucky mom of 3. As you know, I have an 8-year-old boy and twins. So we would like to share with you what problems we had with our skin during pregnancy, how pregnancy can impact our skin, and what to do to prevent or how we can treat these problems. So Tracey, if you don't mind, let's just start with you. So how old is your older child?
My son is 4 years old at the moment.
And how did you find your first pregnancy? Did you have any problems with your skin? Because as a woman, we're going on through a lot, and when we're pregnant, when we're giving birth, breastfeeding, it's just so much changes happening in our body. How your skin reacted to that?
Absolutely. So definitely I've experienced some changes in my skin especially. And considering the pregnancy itself is a pretty normal one. However, I've never had such bad acne skin in my pregnancy. So it was the acne I was struggling with.
Was it just first pregnancy?
It's just the first pregnancy.
And did you do anything to help it? What actually could be done? Because as when you're pregnant, when you're breastfeeding, you're very limited to what treatment we can do on the skin. So what was your solution? How were you coping with that?
I think mainly because my pregnancy was at its peak in my second trimester in summer. So that was when my skin was worst. So definitely sunscreen is a huge factor that's playing it. And I remember when we were just on a holiday in Greece, and that was when I popped out like the largest acne in my life on the face. So I still vividly remember it, and if I hadn't used enough or plenty amount of sunscreen from that time, I would have ended up with really bad acne scars or pigmentations. So I think definitely sunscreen helped.
Well, your skin looks lovely today. It's absolutely flawless, and you would never imagine that you have had acne. So guys, one of the tips here is protection, and that is something that you can do during pregnancy. Tracey, how was your second pregnancy? Was it alright, or did you experience any other problems with your skin?
Yes, so it's a kind of a completely different story from my second pregnancy when I was pregnant with my daughter. She's 1 year old now. So it was actually loads of vomiting problems, and I couldn't sleep properly at night. So you would know lack of sleep and loads of stress and work. My skin has kind of never rested. And again, because of estrogen in pregnancy, you are more sensitive to sunlight. So my problem in the second pregnancy was hyperpigmentation. So I ended up with loads of freckles or even larger pigmentations on the cheeks.
So this we call pregnancy mask, and you know, funny enough, Tracey, I have had exactly the same problem with my first pregnancy, which was almost 9 years ago now. When I was pregnant with my first son, I had a terrible hyperpigmentation, which we call pregnancy mask, and it's actually appeared towards the third trimester. And it took about a year until it's completely gone, and I used different retinols on my skin to treat it. Obviously after I finished breastfeeding, because you can't use any of those products while you're pregnant or while you're breastfeeding. And during my second pregnancy, and it was twins pregnancy, surprisingly, guys, you wouldn't believe, I have been glowing, my skin being amazingly well and flawless. And when I reflect back, what has been different between two pregnancies? changes in my body, it probably was the same, and changes with twins probably has been even more severe because I felt tired all the time. But during my first pregnancy, I always used good skincare, but I was using two brands, Clarins and Elemis. By no means I'm not saying they're not good, but I believe they don't have enough protection or enough active ingredients to treat or prevent things from certain problems. During my second pregnancy, I have been using Environ and IS Clinical products, which is medical grade skincare. I use the range that is suitable for pregnancy, and to be honest with you, I think that is probably the reason why I haven't had any post-pregnancy or during pregnancy problem with the skin. So yeah, that is my story. And Tracy, what do you think women who suffer with different skin problems during pregnancy, what can they do? Because there isn't certain treatments, and actually a lot of treatments that they can't have. So what would be your advice?
So certainly we can't do any kind of invasive treatment like what we do in the clinics, like chemical peels, microneedling, who would be very useful for normal people with skin problems. But there are always very good medical grade, like you said, skincare brands that without the contraindicated ingredients that can help the pregnancy and breastfeeding women.
So good skincare, guys, is probably a first and the most important solution. Facials, what would you say to that?
Any kind of facial, as long as it's non-invasive, doesn't have the contraindicated ingredients such as salicylic acid and retinols, and we should, under the guidance of medical professionals, you could safely use them as an improvement of your skin condition.
Okay, and probably also most important, plenty of rest, look after yourself, and that is a tip to the guys. You should make the lady happy while she's pregnant, and not just when she is pregnant, at any time.
Definitely. Absolutely.
Well, thank you very much, Tracy. It has been very useful, and guys, I hope that you find this information useful, helpful. And if you are a pregnant lady who has any skin concerns, you can book a consultation at our clinic. We offer video consultation, and skincare can be posted directly to your doorstep.